My name is Precious George, and I'm going to be giving a presentation over Indian Health Services. I decided to do this over Indian Health Services because I actually am a Native American. I'm part of Oklahoma Panhandle State University. Okay. The purpose of the program. Indian Health Services is the federal health program for American Indians and Alaska Natives. The mission statement is to raise the physical, mental, and social and spiritual health of American Indians and Alaska Native people. I got this from www.ihs.gov. This program was established in 1787, ensuring American Indians would have access to healthcare services. Those individuals who are federally recognized through the tribe receive services. The Constitution, Article 1, Section 8 established these guidelines for the government and tribes. The funding of Indian Health Services were able to increase the level of health care provided for tribe members in 1976 with the Health Care Improvement Act. Indian Health Services is part of the government in which the government will provide free medical care to American Indians and Alaska Natives. The medical benefits of this program provides aid to so many individuals. Medications are free to Indians, along with surgeries and treatments if the treatment cannot be provided in Indian Health Services centers, then a referral will be made at no cost to the individual. There are treaties put in place by the federal government known as Provisions of Healthcare. The Snyder Act was one of them. It made it legal for Congress to set up the funding for the Indian Health Service program. The laws enacted to establish the legislature for the government to continue to provide these services to Indians. As far as the funding, there are laws in the recent years that continue to protect the funding to the Native Americans. The Transfer Act, Indian Self-Determination and Education Assistance, and Indian Health Care Improvement Act determine how health services are distributed amongst the tribes. There's a picture of there's many American soldiers working in the healthcare facilities, like the facility that that's near to me is the Choctaw Nation facility, where there's many of military men working, especially in the pharmacy. As far as eligibility for these programs, it goes to all Native Americans and Alaskans registered to a federally recognized tribe. As long as the individual is a citizen of the United States, along with the membership to the tribe, they will receive services at no cost. Funds are given directly to the tribe to disperse and provide the services to the tribe members. There is a process of enrolling for a membership card, and research is completed to trace Indian heritage. The benefits of the Indian Health Services program is giving access to health care to over 5 million Indians and Alaskans. In the southeastern Oklahoma region, there are many low-income families. These programs provide many of health support to them. There are rehab services that can help with physical therapy, substance abuse. There are sources of home health services along with health fairs to educate the community. The services offered at Indian Health Services centers and inpatient facilities and outpatient services. There's a pharmacy on site at every center for those who cannot physically make it to the centers. It receives medication via mail. Preventative treatments such as immunizations, dental care, along with optometry services, screening for hearing and speech therapy, also outpatient surgeries are all provided. There's another picture of a lady getting her blood sugar checked. With the Native American community, diabetes is a high prevalence, and I know they dispense glucometers to their individuals at no cost. In the Native American community, there is a high occurrence of hypertension and diabetes. Many individuals are provided with blood pressure monitors along with glucometers. Medical equipment needed to manage chronic conditions are provided at no cost. Referral for treatments are provided with high-risk surgeries and alternative solutions. The Indian Health Services must adhere to HIPAA Privacy Act, maintaining patients' confidentiality regarding the patient's medical record must be protected. The Privacy Act system records is a regulation that must be followed. It's a resource of how the government expects the patient information should be handled. The Federal Medical Care Recovery Act is a policy to where Indian Health Services is able to follow reporting claims to the Office of the General Counsel, establishing reporting requirements and how the recovery funds for claims will be processed. The targeted population of those who can receive benefits of the Indian Health Services are Native Americans that are legally recognized by the tribe, Alaskans who are native to the area and federally recognized. There are no specifications as far as age or medical condition to deny access to medical services. And here's a seal of the Indian Health Services. Since the installation of free Indian Health Services, the mortality rates amongst the Native American communities has decreased significantly. The number of those who are eligible for these services are expected to grow as the need to manage chronic illnesses. The population is living longer and requiring more medical treatments. Indian Health Services has made tremendous impact on individuals of the Native American community. There is evidence of the program's accomplishments by the increase of those enrolled using the services since the enactment in 1955. The program will continue to make a difference by accessibility of the tribe who are low socioeconomic means with health care, with the support of the government with funding to distribute throughout the tribes. And these are my references. This is concluded. I just did this for a couple of fellow nurses. The end. This is the end.